Your fertility workup was normal, right? But you're still struggling to get pregnant? Was any of this tested? Because if not, your workup wasn't complete. Here are the symptom patterns that should trigger investigation for hidden inflammatory drivers, and that conventional fertility medicine almost never connects to infertility. Mold and CIRS, things like brain fog that doesn't improve with rest, fatigue that's disproportionate to your activity level, sensitivity to damp environments, multiple chemical sensitivities, living or working in a water-damaged building, getting sicker than everyone else in the same environment, unexplained neurologic symptoms, chronic sinusitis, or static shocks, chronic Lyme disease and tick-borne illness, a tick bite that you remember or one that you don't, chronic joint pain that migrates, neurologic symptoms such as brain fog, tingling, nerve pain, fatigue that came on after a flu-like illness that never fully resolved, a diagnosis that took years and multiple doctors, and co-infections like Bartonella, histamine intolerance, headaches or flushing before your period or around ovulation, reactions to wines, aged cheese, fermented foods, leftovers, or high histamine foods, symptoms that follow a hormonal pattern, worse in the follicular phase or worse premenstrually, anxiety that spikes after eating, skin flushing or hives without a clear allergic trigger. Any of these combined, unexplained infertility, short luteal phase, low progesterone, recurrent early pregnancy loss, AMH that doesn't respond to optimization, cycles that remain irregular despite intervention. Here's what a complete hidden driver investigation actually looks like. Urine mycotoxin panel. This identifies specific mycotoxin accumulation in your body. A CIRS biomarker panel. C4A, TGF beta 1, MMP9, MSH, VEGF, ADH, DHEA, the biotoxin inflammatory picture. HLA genetic susceptibility testing identifies whether you have a gene variant that prevents biotoxin clearance. Specific Lyme testing, such as the Western blot plus IgG X for co-infections. DAO enzyme activity testing. This is for histamine clearance capacity. OAT test, organic acid testing. This reveals gut dysbiosis, mitochondrial dysfunction, and nutrient deficiencies that all of these conditions can create. None of these are on a standard fertility panel, and all of them are available. The investigation is incomplete until all of these have been ruled out. Comment root cause below, and I'll send you the link to my free fertility webinar.